Hello there. I'd like to take a moment to talk with you, not just as your doctor, but as someone who truly cares about your health. Let me ask you something simple. When was the last time you really looked at your feet? I don't mean just trimming your toenails or putting on your socks. I mean actually checked your feet, gave them your full attention. You see, for many older adults, foot care becomes something we tend to overlook. But here's something I want you to remember. Your feet are the foundation of your independence. They carry you through your day, help you stay active, balanced, and mobile. And when they're not healthy, everything else becomes harder. Now, as we age, several changes naturally happen. The skin on our feet becomes thinner and drier. Nails grow more slowly but often become thicker and harder. Blood flow to the feet may decrease, and our ability to feel pressure or pain can fade. All of this means small foot issues, things that might have seemed harmless in the past, can become serious if left unaddressed. In fact, foot problems are one of the leading reasons seniors lose mobility. But here's the good news. Most foot problems can be prevented with simple daily habits. So, let's go over a few common mistakes I often see, and what you can do differently. Mistake number 1, not washing and drying your feet properly. It sounds basic, doesn't it? But many folks don't actually clean their feet in the shower, and even fewer dry them carefully between the toes. That extra moisture becomes the perfect place for fungus to grow, leading to itching, infections, and athlete's foot. What I recommend: wash your feet daily with mild soap. Rinse thoroughly. Dry them well, especially between the toes, and if needed, use a separate towel just for your feet. Mistake number 2, ignoring dry, cracked heels. Cracked heels might seem like just a cosmetic issue, but they can bleed. They can become infected. And if you're diabetic, this can turn into a dangerous foot ulcer. Use a gentle moisturizer made specifically for feet. Apply it daily, but don't put lotion between your toes, just on the heels and tops of your feet. Mistake number 3, wearing the wrong shoes or socks. Far too often I see patients wearing shoes that are too tight, slippers with no arch support, or socks that actually restrict circulation. And over time, this can cause bunions, joint pain, and even impact your posture. What I recommend? Choose supportive shoes with a wide toe box. Get your foot size checked once a year. Feet can change shape with age. Use non-slip socks and consider light compression socks if swelling is a concern. Mistake number 4, overlooking nail changes. Thick, yellow nails aren't always just aging. Often they're a sign of a fungal infection, which can spread and cause real pain. What I recommend? Don't try to file or trim very thick nails on your own. Instead, schedule a visit with a podiatrist. They can treat it safely and effectively. Mistake number 5, not checking your feet regularly. Some patients don't realize they've got a sore, a blister, or a cut until it's already infected. This is especially true if you have diabetes, poor circulation, or nerve damage in the feet, what we call neuropathy. So, here's a habit I'd love you to build. Do a daily foot check. Use a mirror if needed, or ask a loved one to help. Look for redness, swelling, sores, or changes in color or temperature. Now, let me be clear about something. Foot pain, numbness, or changes in your feet are not something to ignore. If you notice burning, tingling, pain when walking, a wound that won't heal, or even just a change in skin color, please don't wait. Make an appointment with a podiatrist. It could be nothing, but it could also be the early sign of something serious, like circulation problems or nerve damage. Your feet have carried you through decades of life. Now it's time to return the favor. Wash them gently. Moisturize them with care. Wear shoes that truly fit and support you. And pay attention to the little changes. Because healthy feet, they mean more walks, more freedom, more confidence, and fewer doctor visits. If you've made it this far, thank you for taking time for your health. It's one of the best gifts you can give yourself. And if you found this video helpful, share it with someone you care about. Subscribe for more health advice from someone who's always in your corner. Take care, and I'll see you in the next one.